Vitamin E has long been associated with enhanced wound healing, offering support at every stage of the skin's repair process, whether applied topically or taken internally. Its benefits go beyond basic tissue regeneration, touching on inflammation control, scar prevention, immune modulation, and cellular restoration. When the body sustains a wound, such as a cut, burn, abrasion, or surgical incision, it triggers a complex series of responses that includes clot formation, immune cell activation, collagen production, and ultimately the rebuilding of skin architecture. Vitamin E, with its antioxidant and anti-inflammatory power, actively supports this process and helps ensure more complete and cosmetically favorable healing. One of the central mechanisms by which vitamin E accelerates wound healing is through its ability to neutralize free radicals at the site of injury. Oxidative stress increases sharply in wounded tissue due to cellular damage, exposure to air, and the inflammatory response itself. While some level of oxidative activity is necessary to signal repair, an excess of reactive oxygen species can impair fibroblast activity, cells that produce collagen and extracellular matrix, delay epithelial closure, and worsen tissue damage. Vitamin E steps in as a lipid-soluble antioxidant, protecting both cell membranes and structural proteins from this onslaught. This protective effect helps preserve tissue integrity, reduce swelling, and support the regeneration of healthy new cells. In burns, especially minor or first-degree burns, vitamin E has shown promise in reducing blistering, accelerating epithelial recovery, and preventing post-inflammatory pigmentation or scarring. When applied topically in the right concentration and form, typically as alpha-tocopherol or a mixed tocopherol-tocotrienol complex, vitamin E can help soothe the damaged skin, reduce redness, and promote faster restoration of the protective skin barrier. Its moisturizing properties are also helpful in keeping the injured area from drying out or cracking, which can impede healing and increase infection risk. Vitamin E's support for collagen synthesis is another reason it's beneficial for scar management. Collagen, the protein that gives skin its strength and structure, must be laid down in an orderly, well-regulated fashion during healing to avoid raised or irregular scars. By protecting collagen-producing cells from oxidative injury and helping modulate the body's inflammatory response, vitamin E encourages a more balanced remodeling phase. Some studies suggest that vitamin E may reduce the formation of hypertrophic scars or keloids, especially when combined with pressure dressings, silicone gel, or other medical therapies. However, it's important to note that topical vitamin E can occasionally cause irritation or allergic reactions in sensitive individuals, particularly if the skin is broken or if synthetic forms are used, so patch testing or professional guidance is wise. When taken orally, vitamin E supports wound healing systemically by enhancing immune function, especially in the early stages of repair when white blood cells are needed to clear debris and protect against infection. This immune-enhancing effect is particularly useful for individuals with compromised healing capacity, such as those with diabetes, vascular insufficiency, or nutritional deficiencies, who may struggle to repair skin and tissue efficiently. Vitamin E also helps reduce systemic inflammation, which can interfere with proper collagen formation and prolong the healing timeline if left unchecked. The combined oral and topical approach is often the most effective. Oral supplementation ensures that vitamin E is delivered to deeper tissues and supports the underlying metabolic and immune processes, while topical application provides direct nourishment and antioxidant defense to the wound surface. To optimize results, it's best to use natural forms of vitamin E, particularly those that include both tocopherols and tocotrienols, since these different forms offer a broader range of tissue-specific benefits. In conclusion, vitamin E is a highly versatile ally in wound healing. Whether dealing with minor cuts, surgical scars, burns, or chronic wounds, it helps speed the process of regeneration by calming inflammation, protecting new cells, supporting collagen formation, and maintaining optimal skin hydration. While not a cure-all, when used properly and as part of a broader healing strategy, vitamin E significantly improves both the function and appearance of healing skin, offering a safe and natural way to support the body's innate repair mechanisms.